Health and Fitness Mechanic back in the garage for episode number 2. We're going to continue focusing on the low back. So if you watched episode number 1 and you've mobilized those hips, gotten rid of that pelvic obliquity or rotation, good, you're good to go. If you haven't seen it, take a look because you want to watch that and you want to do that piece first. Now that you've got the hips aligned properly, we're now going to start doing some soft tissue work on the musculature that goes around the hips. And the reason that we're going to continue focusing on the low back, if you read my Who Am I piece on my blog, you'll know that I like to make lots of analogies between cars and humans. And the spine is the chassis for the car. The legs go into the low back. They're your powerful movers. So that's where you want to start. And also, this is one of the most difficult places that people have pain. It's one of the areas that we see a ton of people in the clinic dealing with some discomfort. Reason being, most of you sit around at a desk all day long. Those hip flexors, what they do, they pull you up into this position. So when you stand back up and you're really tight in the front of the hip, you're living like this. Low back, extra arched, extra tension. So what we want to do is start cleaning up some of those areas, getting them to be soft and back to that sliding surfaces, doing what they're supposed to be so that they're at their resting length and then you're at full range of motion in those hips. So we're going to introduce soft tissue work on yourself for the first time. I kind of call this your $100 hour in a massage for somewhere in the range of more like $3 to $5 because it depends on what kind of ball you're going to be using. Today, we're going to use a softball. That's the ball I like to use for my hip flexors. And I just want you to keep two things in mind. One, if you happen to get any numbness and tingling anywhere, cease and desist immediately. This means you're on a nerve and that's really, really bad. Also, if you get any pulsing sensation, you're now on an artery. Also bad, and stop immediately. You need to stop immediately. And especially today because we're going to come across that hip in the range of that femoral artery, which supplies blood flow to your legs. So really, really important that we don't pinch that off. Otherwise, you're going to find some discomfort. You're going to feel some stuff that's not enjoyable, and that's going to get better, and that's what's going to help us to start get better. So start with number 1, just empty breath out of your belly. Take your fingers, dig into the side, and I almost guarantee that you're going to find something really uncomfortable and tender. And that's where you're going to start. You're going to get that ball in that area. So we're going to do this laying down on the floor on your stomach. If you don't want to lay on your stomach on the floor, option number 2 is to kind of bend over the kitchen table. But I'm going to do it on the floor, so I'm going to bring you down with me. Okay, now that we're down on the floor, we're going to take that ball, we're going to set it right underneath that hip. We're going to put as much pressure as we can tolerate and move around until we find something junky, uncomfortable, gnarly, whatever word you want to use. And we're going to just sink into it. You can start to kind of lift your body up. That's going to tension those muscles a little bit more and let you get a little bit deeper. And you're going to hang around on it for, 30, 45 seconds. And then one of the things we're going to do is we're going to do a contract relax. So we're going to squeeze our muscles really, really hard. In this instance, your abs. So squeeze for 5, 4, 3, 2, 1. Breathe out and relax. And sink deeper around that ball. You're going to feel that maybe you get to a deeper layer, and that's important. Also, we're going to grind side to side over that tissue. And this, again, you're kind of playing it like a guitar string. It shouldn't be very comfortable. If you feel the pain, the tenderness start to dissipate, that's a good thing. It means that the tissues are recovering and they're getting better. Once that happens, move to another area. Usually you don't have to go very far and you just find something new. You're going to spend 5 minutes at the minimum per hip, and that's going to be your soft tissue work for your hip flexors to help start getting rid of that exaggerated lumbar curve and making that low back start to feel a little bit better because you can get into a better upright position. That's it for episode number 2. See you back for episode number 3.